There is another type of autonomic dysfunction. We all have something called autonomic tone. There is a peaceful side of that tone and a stress response side. When we are physiologically at peace, we call that parasympathetic tone. When we are stressed physiologically, we are in sympathetic tone. Often we fall into this tone somewhere in the middle at baseline. Often maybe a little towards sympathetic because we have stressful lives, stressful work, just a lot of stuff going on in the world. But there are things that can influence us to be more sympathetic. Those things might include acute trauma or a history of trauma, a history of poor sleep at baseline, insomnia, stress, anxiety, and other medical conditions that can cause us physiological stress. We believe that a concussion can tip you to become even more sympathetic. The thing is, when you are in sympathetic tone, you can experience symptoms attributable to sympathetic autonomic dysfunction. Those mimic and or appear to be very similar to concussions. Headaches, troubles with thinking, troubles with sleep, ringing in the ears, tinnitus, which is very common in these conditions. It can also affect how we sleep and how we think effectively and clearly. It can create palpitations. It can create slurred, stuttered speech. It can create troubles managing our body temperature and other things. It's a very strange situation. We know that we have techniques to help move people into the parasympathetic or more positive physiological state. Those would include modifying sleep, optimizing sleep, exercise. We have found that exercise is an incredibly powerful tool to create more parasympathetic tone. You hear about runner's high when people go out and they run, or they go to the gym and they work out and they feel good afterwards. That's because they're more parasympathetic. So we use those same tools in situations where we feel like people have dysautonomia or autonomic dysfunction. We also focus on mindfulness, meditation, sometimes counseling or psychotherapy. And of course, occasionally we use medications to help, because a lot of this autonomic tone is mediated by neurotransmitters or chemicals like serotonin and dopamine and cortisol. Altogether, it may take a multifaceted approach, but we can take folks that are too sympathetic and having all these symptoms and help them find a better balance so that they recover and just feel better more quickly.